Myself is Dr. DNYANOBA BHASKAR, diabetologist from Lifeline Hospital, Pune, Bagoli. I am working there as a diabetologist since last 15 years. So I have completed MBBS and Diploma Diabetes from Mumbai University, Maharashtra.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
Yeah, if you see, Imeglimin is launched in India, and we know that there are so many anti-diabetic medications which we are using in type 2 diabetic patients. But Imeglimin is a special, different kind of anti-diabetic agent. So we are using Imeglimin in practice because it has got unique mechanism of action, like it reduces the insulin resistance, it increases the insulin secretion, and it reduces the hepatic gluconeogenesis. So it is used as an add-on therapy when other OHAs are not able to control the blood glucose level.
In what specific patient populations do you see the greatest benefit of using Imeglimin?
We are using Imeglimin as an add-on therapy when other OHAs are not optimally control the blood glucose level. Because we have seen that many patients need lot of OHAs and many higher dose of insulin. So when we add insulin to such patient, their number of OHAs goes down. Then insulin dose we have to reduce it. And the beauty of Imeglimin is that there is low risk of hypoglycemia and lesser side effects, and it is tolerable also. So when patient is having metformin intolerance or GI side effects because of metformin, then we add the Imeglimin and we get the benefit of reduced insulin resistance and increased insulin secretion. So because of this, there are chances of that patient may need less OHAs, and we have to reduce the insulin dose also. We have seen in day-to-day practice that when we add Imeglimin to diabetic patients, then insulin dose is drastically reduced in some patients. So this is my practical experience, and surprisingly, this is not dependent on the duration of diabetes. Means it is not like that we have to use in newly diagnosed type 2 diabetes or elderly population. So irrespective of duration of diabetes also, it gives effect in such patients.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share any real world case if you have.
Certainly, there is a difference between Imeglimin and other anti-diabetic drugs. Because if you see the sulfonylurea, there are chances of hypoglycemia. But in case of Imeglimin, there are no chances of hypoglycemia. It is, I will say, it is a smart agent, and there is no risk of GI side effects, and it is a durable anti-diabetic medications. Like durability is there, efficacy is there, and safety is also there. So if you compare with metformin, it is better tolerable, and unique mechanism of action is that it acts on the mitochondria. It reduces it reverses the mitochondrial dysfunction. We know that in diabetic patient, mitochondrial dysfunction is there because there is a effect of free radicals. So Imeglimin, it reduces the mitochondrial dysfunction, and we know that mitochondria is the powerhouse of the cell, and it is the energy center. Energy in the form of ATP is synthesized in the mitochondria. So it acts on the mitochondria. Because of this, there is a reduction in the insulin resistance. There is a secretion of insulin, and another point is that there is reduced hepatic gluconeogenesis also. So overall effect is that it is having glucose dependent insulin secretion, and because of this, there is less chances of hypoglycemia when we are using imeglimin. So these are the differences between imeglimin and other OHs.
In recent time, Imeglimin sustained release formulation with the Indian study has been launched in India. What is your opinion on that?
Yes, definitely. Uh, we have very good experience with imeglimin sustained release. See, initially we use immediate release uh, imeglimin, but when this we are using sustained release imeglimin, it is having less GI side effects, it is better tolerable, and it is efficacious. So efficacy is better with sustained release formulation. If you compare with metformin, if some patient is using 1000 milligram of metformin or 1500 to 2000 milligram metformin, their doses we have to reduce by 50%. And in some patients, we are reducing the insulin doses also. So sustained release formulation is better as compared to immediate release formulation of imeglimin.
How does the mitochondrial targeting mechanism of Imeglimin influences its clinical use?
Yes, as I have already told you that in diabetic patients, there is a mitochondrial dysfunction. It is affected in diabetic patients. So imeglimin exactly acts on the mitochondria only, and it reduces the free radicals, and it because of mitochondrial better functioning, there is a decrease in insulin resistance, and there is increased insulin secretion, and there is means reduction in the hepatic glucose output also. So because we have seen that mitochondria is the powerhouse of cell, and ATP is generated in the mitochondria. So when imeglimin acts on the mitochondria, it gives better effects in type 2 diabetic patients, and it reduces the blood glucose level. So this is the mechanism of action in type 2 diabetic patients. And because of this, we can combine imeglimin with other OHs. It has got synergistic action with other anti-diabetic agents. And this is the beauty of imeglimin. We can combine with other OHs and it gives better effect.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
See, if you see the safety issue first, it is GI, it is having less GI side effects, and it is tolerable also. So tolerability is not an issue. And coming to the efficacy point of view, we have seen that it is having unique mechanism of action on the mitochondria. There is no other molecule which acts on the mitochondria in diabetic patients. So imeglimin is the only molecule which acts on the mitochondria. So it is having durable mechanism of action, and it is efficacious also. We can combine with other OHs to reduce the doses of similarly acting molecules like metformin. If you see the metformin, then again we may reduce the doses of insulin also because of imeglimin.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yes, definitely. As we have already discussed that imeglimin is the only molecule which acts on the mitochondria. Another point is that it is a glucose dependent mechanism of action. Then third point is that it is it reduces the hepatic gluconeogenesis. Fourth point is that we can combine with any other OHs because of synergistic mechanism of action. So as an add-on therapy to the existing diabetic patient's medication, we can use the imeglimin. And sixth point is that it has got sustained release formulation, which is better tolerable, better efficacious with lesser and lesser side effects. So because of this, Uh, there is a huge scope for imeglimin in practice in our type 2 diabetic patients.
Any other key points or any take home message you would like to share apart from these?
Yes. See, in practice, we are using this imeglimin molecule in type 2 diabetic patients. And I have seen in my practice, it reduces the insulin doses drastically in some patients. And another point I have observed in day-to-day practice, diabetic patients, main complaint is fatigue. Even when we are controlling the blood glucose level, they complain fatigue, muscle pain. These, when we start imeglimin, their fatigue symptoms are drastically reduced. Muscle pain is reduced. So these are very good effects of imeglimin. So a good molecule to use as an add-on therapy in type 2 diabetic patients.